sets us up nicely for NBC News medical contributor Dr. Joseph Fair. Dr. Fair, good morning. It's good to see you. Let's talk about this surge in cases because, of course, when you start reopening, you know that you're going to get more cases, and we're seeing that. How do we know if this surge is something that could lead to an outbreak that would be a real concern?
Well, that's definitely what we're seeing in these states. And, the analogy or the point earlier about having more tests is going to reveal more cases. That's actually true. But what we really go by as a differentiator here with COVID-19 is how many hospitalizations are you seeing? So that would indicate new cases that you wouldn't have picked up even if you did, if you didn't have the diagnostics or whether you did or not there. So those are the people that are getting acutely ill. So that indicates it's a bigger problem than what we thought it was. And so we're seeing record hospitalizations in the states that have opened up really early, that have maybe been somewhat laxed with their earlier social distancing measures. And we're seeing that right now. We're seeing record jumps in all of those states as they rush to open up.
And we remember, of course, from when this was acutely happening in March and April, the concern being that if you have that surge of cases, suddenly you're overrunning hospitals, you are straining resources. Is that the situation that's setting itself up in some of these southern and Sunbelt states, or are they better equipped to handle this surge?
I would say they're very, little better equipped than they were, say, 2 to 3 months ago, other than experience with treating patients. So, there's still going to be problems with PPE. There's still going to be a problem to have enough diagnostics. Say if there is a massive surge of cases coming in, we have many more diagnostics than we did before. But, that is accounting for the number of cases we had, not necessarily for the number of cases we will have. And so if those numbers surge, we're going to face an additional strain on the system. And right now, we really haven't seen a dip in the cases. We saw a flattening of the curve, if you will, and maybe we shouldn't have used that term early on. We want to see a drop in the curve. So we've seen a plateau. So technically we are still in the first wave, and the second spike that we're seeing is really induced by ourselves. It's induced by us opening up early and moving on from the problem before the problem has moved on from us.
Let's talk about this hopeful sign, a drug that is in, as I understand it, every pharmacy. It's cheap, it's available, and is showing real promise in treating the most severe COVID-19 cases. Tell us about it.
Well, first of all, I want to say, what we have from this is a press release about the data. We haven't actually seen the data yet. But if the data holds up, it is extremely promising. Like you said, it's a cheap, readily available drug that's been in use for a very long time. It's a commonly used steroid that would dampen the immune response. A lot of what we see in the most critically ill and severe cases of COVID-19 is your own immune system overreacting to a pathogen that it's never encountered, or a virus or a bacteria that it's never encountered. So what your immune system does is basically throw every tool in its arsenal out. And on a normal kind of flu or cold, you wouldn't do that. So you get moderately ill. When you do that all together, all at the same time, you get extremely ill. And that's a lot of what we see patients kind of dying from or contributing to their death. So this drug itself dampens that immune response and allows you to kind of handle it without overreacting, per se, with your immune system.
And the researchers say they are going to put forth a more formal study, but wanted to get the information out there because of its potential implications for people who are sick right now. Dr. Fair, who has recovered from COVID-19, it's good to have you with us again. Thank you so much.
Thank you so much.